So hi everyone, I'm Professor Sally Theobald. I'm a chair in social science and international health here at Liverpool School of Tropical Medicine. And it's a real pleasure to be hosting this LSTM In Conversation podcast with our brilliant guest, Dr. Bertha Simwaka. So Bertha's an LSTM alumna. She graduated with her PhD in 2007. And I was one of her supervisors, and Bertha and I had the privilege of working with Bertha and other brilliant colleagues in Reach Trust in Malawi between 2004 and 2006 for me. And Bertha has had a brilliant career spanning 20 years and is Senior Fund Portfolio Manager for Zambia at the Global Fund. So, Bertha, it's really wonderful to have you with us today. I'm really genuinely looking forward to discussing and catching up and hearing your experiences. Bertha, can I just start by asking you to tell us about your experiences of doing a PhD at the Liverpool School of Tropical Medicine and the impact that that's had on your career?
First of all, I just want to thank you, Professor Sari and team, for giving me this opportunity. I really missed the community, and I think this is a way of connecting with the community, and I'm so excited about that. I hope we can have even more interactions in future. So just reflecting on my journey in terms of my PhD. So I think you've already mentioned that I graduated in 2007. And I was so lucky that, my PhD was nested in a program that was already, running. It was a collaborative consortium. It was a consortium between the Liverpool School of Tropical Medicine, the University of Malawi, and the Ministry of Health. And specifically, of course, we're working with the Community Health Sciences Unit, which now, in fact, it has transitioned. It's a public health institute. In Malawi, kind of like a national arm for health security in Malawi. So basically, I think I say it was an opportunity for me because I think it gave me an opportunity to explore like what path do I want to take in my career life. And I want to say that one unique issue that I think when I speak to other people comparing my experience with LSTM and other universities, like LSTM, I think it gave me a real-time experience of what international health, global health, and public health is. And also, like a space, like field laboratory in terms of how applying, multidisciplinary skills. And it was at a time when the concept of gender, health, and equity were just becoming prominent within the health sector in Malawi and also at global level. I remember we had to discuss quite a lot in terms of, okay, how do we frame equity in a way that the biomedical expert clinicians can understand it. So I think it gave me a live kind of laboratory in terms of, understanding international health. I think also LSTM community is unique in that I think the passion about, like building knowledge that is so applicable and practical in the context of, developing countries, in the context where, you are still building the health system. So that experience, you can, of course, hone your academic skills. At the same time, also, have an environment in terms of academic environment that looks towards, creating solutions, practical solutions, innovations in terms of how health services can be implemented in a way that it makes sense, especially, in a context where there are gender-related challenges, cultural and also geographical challenges. And then also, having that community that is so passionate without compromising in terms of the quality of new technologies for health, bringing in the aspect of how do we reach the poor, of the poorest, how do we reach women. So that was a very exciting component. And I would say that it laid a strong foundation for what I'm doing now at a global fund and also what I've been doing with other entities.
Thank you, Bertha. Yeah, that's really great to hear. We're really proud you're our alumna, and really nice to hear about the focus on context-embedded learning, on multidisciplinarity, and as you said, gender equity, pro-poor approaches. How do you make them real and accessible, and also focus on problem solving and impact? So thank you very much for those reflections. And I wondered if you could tell us a little bit about what happened next. So your journey
Yes.
to your current role as Senior Fund Manager for Zambia at the Global Fund.
Yeah, so of course, after graduating, I had some years working also with within the consortium of Rich Trust.
Yeah.
And then, of course, I decided just to explore, in terms of directly working with the program. So I spent some 3 years in Zambia, working mainly with the malaria programs, with a path, which was implementing a guest-funded program. I joined the Global Fund in 2013, initially as an evaluation and impact expert, and then I moved on to Grant Management Division. Why I moved on to Grant Management Division is because it's kind of like the face of Global Fund to the countries, and it gives an opportunity in terms of shaping programs, investment, and therefore, bringing in all those, skills that I gained at the Liverpool School of Tropical Medicine. And maybe for those who don't know Global Fund, maybe it's an opportunity just to say what is Global Fund. So it is a partnership. It's a public-private partnership that draws together, civil society organization, governments, and the private sector to mobilize resources. Of course, it was created, by a team of elders, including Kofi Annan, back in the years 2002, with the purpose of mobilizing resources for HIV, TB, and malaria. But of course, now, we also look at issues of, strengthening health systems, pandemic preparedness, and also mainstreaming gender, human rights issues in the programs. So just that snapshot of our Global Fund. And then in terms of where I am now, so I mentioned that I started as evaluation and impact specialist. Then I moved to grant management, which is kind of like the face of Global Fund with the countries. And my first role was a public health and monitoring evaluation expert, which is basically like you work with different portfolios, looking at issues of programming, and then also ensuring that the investment is strong, and also you have built in the concept of understanding the impact, because performance is very important for Global Fund. Results are important because they are the ones that define in terms of resource mobilization and advocacy. So I spent almost 5 years in that role, and then of course there was an opportunity. I moved on as a disease fund manager, which kind of like fund portfolio manager, but I was only focusing on HIV, and I did that for 4 years, working with India, the Indian government in terms of the National AIDS Control Organization in India, and also non-government organizations that were like implementers of programs that we fund in India. And then after that, of course, I got an opportunity. It's almost 2 years now that I've been working as a senior fund portfolio manager for Zambia. In Zambia, the portfolio that I'm overseeing right now is around, I think, $360 million. And we are funding TB, HIV, and malaria programs. We also work with the Zambia National Public Health Institute, which is like an entity like Africa CDC at national level, and they are the ones that have the mandate to coordinate, like respond to epidemics, to outbreaks, and also like the issues of surveillance, rolling out surveillance. So we work with them and support their strategy in terms of rolling out this surveillance system, but also effectively responding to outbreaks. And then, of course, we also work a lot in terms of supporting the country building strong systems for health. And one of the of portfolios in the system strengthening is community system strengthening in Zambia, where we're working with the Minister of Health to kind of like, create a strong policy environment for working with community-based volunteers across all diseases, and then also empowering them in terms of capacity building with tools, and also, systematic issues like supervision to ensure that quality of services, but also they're equally motivated. So I think basically I would say my role as a fund portfolio manager is like, providing leadership and oversight for the portfolio.
I imagine it must be really good to be working in a country and context that you know well. You said that you were in Zambia post your PhD for a while, and you've talked about the leadership role that it entails and the number of different stakeholders that you work with focus on community health strengthening as well as broader health system strengthening. So I wondered if you could tell us a little bit about what advice you'd have for others from that process and from your leadership role.
Yes, so I think what I would say, especially for the young, maybe our fellow young colleagues that have the ambition to work in global health or international health, I would say that, whatever you're doing now will kind of like shape your life. So every opportunity that you have, whether it's, college at LSTM or you're doing your thesis, every opportunity that you have is a pathway to where you want to be. And then also in terms of leadership is not a matter of position. Leadership is how you pursue your goals and how you work with others in terms of, building their support towards a goal that you are convinced that is the right mission for community, for yourself, for others. And it's basically whatever you're doing now. And also, I think the issue of, finding value in multidisciplinarity these days is very important, especially for those that have the ambition to grow their career in international health. Of course, we know that, we all have our own backgrounds, but for you to be successful, you have to embrace the role of different, disciplines, whether it's clinicians, other disciplines like community prayers. I spoke about community-based volunteers. These are, people that are just community members who find it like a joy in terms of serving others. So it's embracing the disciplinarity of health. That will help you also in terms of to work in future, whether it's at a global level or at national level, because we cannot talk of international health without really talking about the multidisciplinary nature of health and also multicultural, nature of the ecosystem that we deal with. And then, of course, learning is not just in class. As I mentioned earlier on, I had the opportunity of doing my PhD that was nested in the program. You might not have that opportunity, but there are so many opportunities that you can also explore. For example, maybe during your, when you have semester break, taking a volunteer, role somewhere. There's that opportunity. I would encourage you to do that. And also kind of like reaching out to alumni that had been at LSTM like myself. I'm free to pick and to encourage, but also to support in terms of what path you would want to do. Because, we are a community and we have to nurture and support each other. And then also we have to connect because connection is very important. Learning how to connect with different disciplines, learning how to connect with other prayers that you might not really agree in terms of some principles, but finding entry points that you can leverage, your knowledge and also, the areas where you have commonalities.
Oh, Bertha, that's brilliant. And thank you for also offering support and advice. I know that people would really benefit from that. And I really like the idea, we all have the opportunity to be leaders. It's not about position. It's about how we work together, how we build connections, how we build those ideas of supporting cultures of mutual support and understanding and driving forward and transdisciplinarity and seizing opportunities when they come.
Yes.
So, thank you for that brilliant advice. And I wonder if we could take you back to your current role and whether you could give us some examples of a particular part of the portfolio in Zambia that has really had positive health outcomes for equity.
So I would say that, of course, there are several players in Zambia. Global Fund is one of them. We also have, US, funded programs like PEPFAR and others, and also the government itself. I would like to mention that I think the HIV program has brought in a lot of results in terms of like value for money. When all these investment were coming in, there was even a saying that the coffin industry, it kind of like boomed because of the number of deaths or mortality related to AIDS. But with the coming in of all these health financing mechanism, including Global Fund, we can say that at least that has been reversed. And then, of course, we still have a fight, but in terms of also the new infections for HIV, we see that they have gone down. Of course, there's still a lot of work, especially among the adolescent girls and young women, and also what we call the key populations. In the context of key populations, it's like female sex workers, MSM, and also people that use like drugs, IDUs. There's still work to do. But I think one of the successful stories is that, the role of communities in highlighting the importance of these groups, the importance that we cannot, reach the final target of making HIV not as a public health threat if we don't reach these key populations, even in the African context. Especially in the context of Zambia, the young people, they are still like the highest, affected. So that is one of the areas that we've seen results and impact, scaling up of treatment, and also reversing the trend of mortality and new HIV infections. There are also other areas, because of this investment. We've seen like the strengthening of laboratory networks. Initially, it was so difficult to move, to transport sample from one point to another. But through collaboration and partnership, there's strong hub and spoke networks that ensures that services reach everybody, including women and also key populations, because you cannot reach them if they don't have access to diagnosis and also treatment. So that's one of them. And then, of course, that brings in the issue of, in general, all these systems. Of course, initially, the focus was to bring services for TB, HIV, and malaria, but they have had spillover impact, positive impact on the national response. Like recently, Zambia had a very, catastrophic cholera outbreak due to climatic issues. But they were able to reverse and respond effectively because of a strong community system network, strong surveillance network, and strong laboratory network. So these helped them to detect early and also to know where they have hotspots and then respond effectively. So there are so many positives, but the work is still there.
Yeah, thank you, Bertha. It's a really insightful example. And the focus on different groups that experience multiple vulnerabilities and the need for lab system strengthening and working with communities at every part of the journey. And I like the way you've explained how system strengthening has positive repercussions beyond HIV, TB, and malaria. And that's really inspiring in terms of the cholera response. So thank you for those. So just how does it work then for you and your daily role? How much time do you spend in Geneva? How much time do you spend traveling to Zambia and other contexts? What does it feel like on a day-to-day basis to be an international global health expert?
Yeah, so okay, of course, I want to say it's not easy, it's complex because I have children, because there's some some young women would say, will I manage with my family and also traveling? So I think from that angle, I would say it's like one of the areas that worked well for me is also, beside work, is also building a strong social, support system for yourself is very important, especially when you have a family and children. So in terms of the work, basically, I travel between 30 to 40% of time. Like once every quarter, I have to go to Zambia with a team that works on the country to just, follow up, with the country, also undertake, political, it's all politics. Health is also politics, without the politics, we can't move forward. Of course, positive politics for health, not negative politics. Coordinating with all the partners from governance perspective, and then also monitoring that the programs are running well. In case maybe there are issues, these type of missions, they help us also to unpack those issues and then respond effectively. So it's kind of like that. And then sometimes it can be more depending on the, what is going on, the dynamics at country level. So I would say that, in fact, I enjoy most of the time during the missions in country, because we learn a lot from the prayers in country, prayers, the civil society, the government, and also other prayers. One thing I want to also mention is like I think over the years I've learned it's an issue of listening to the country. It's very important because most of the times for the challenges that we face in our work, the solutions are there. They know the solutions, and sometimes it's just a matter of encouraging them, like inspiring them to move forward and implement. I think this has been a learning curve for me, and the other, and this is not just unique to Africa, because I also worked on India for almost 4 years. Solutions are usually in country. The community members, they have the solutions, and the prayers in the government cycle, in the civil society, they have the solutions. But sometimes it's just convening, that aspect of convening, so that there is a conversation, having positive conversations around issues, so that you can collectively address issues.
Yeah, Bertha, that's brilliant. And I think really lovely insights about leadership, about listening, convening, inspiring, encouraging, and that the solutions are within the context that we work with, and being part and parcel and partnership there. And yeah, health is certainly political, and the personal is also political. And I like the way you reflected on your personal journey and what it means to be a mother working in international health, and the need to build up strong strategic support networks too. So thank you very much for those reflections. And I think what we'd love to hear more of as well, from your embedded position in this international level, working with national portfolios, is where you see future trajectories in international health. What do you think the key issues and key challenges are? If you had a crystal ball, what would you say?
That's a very important question, but I'm not sure if I have answers for that. I'll just say like I think all of us have been on a journey. When I say, I mean all of us, I think within the ecosystem, like different prayers, that's like healthy financing, mechanisms, agencies, and also the countries, civil society, everyone. We've been on the journey, and I think now the space is like, okay, there's that opportunity to reflect in terms of, okay, how best do we work? Because there was a point in time where we would say maybe, okay, the issues of capacity, of course, we still have to deal with those issues at country level in a different way. But, the countries also have grown so much in terms of, if there's a cycle of, capacity in terms of health system, I think there have been quite a very positive, growth in the country, in how, they also manage the negotiations with the international entities, and then also defining the programs and response. Of course, we still need to build the human resources for health and others, but I guess we are at a time when we all have to look at, like, we reflect in terms of where do we focus more in future. Do we focus more in the way we've been working in the past, like, okay, specific areas, or we take more kind of like a comprehensive approach, maybe tailor-made solutions for each and every country? And then also, I think there should be also an acknowledgement in terms of Of course, there are domestic financing challenges, but there's quite a lot of goodwill or willingness from the countries to build their own, resources internally to beef up the response for different issues that the countries are facing. The question is like, how best then do we leverage the additional resources? So it's a complex stage. We are at a complex stage that I think we all have to maybe honestly reflect on, and I think that would define whether we will be the level of impact that we've had in the past will continue or not. How we move forward from now onwards in terms of how we work together at international level, like the research institute, the financing organization, and also other implementers, and then also appreciating the in-country already existing capacities that is already there. I think the bigger issue is like, okay, if we make a shift, then how do we sustain the gains that have already been made? I think there's that huge risk that all of us, I think we really need to acknowledge, including the countries. Like, how do we manage that we don't lose the risk? The gains that were made, if we make any type of transition that we want to make. Do we have investment in sustaining those gains? And then what do we need to ensure that we are sustaining at the same time we are also maybe moving towards transitioning and all those things.
Yeah, very interesting reflections, Bertha. Thank you for sharing. And LSTM is 125 years old now.
Yeah, congratulations.
Yeah. So we're also going through a process of reflection around our role in 2024 and how to make ourselves fit for purpose and with a decolonizing lens and the partnerships that we bring. So it's interesting to hear you reflect too on sustainability and transitions. So I guess, are there any other thoughts that you have for our fellow alumni, LSTM community, current and past students? Any further thoughts or reflections or advice? You've had this incredible career, and of course it's ongoing. The embedment in Malawi, the PhD, the work in the different knowledge programs, work in Zambia, and then all these different roles within the Global Fund, but with a particular focus on India and on Zambia. Any further advice, thoughts, or reflections for the LSTM big community, big as in all of us that are here or have been here or linked with LSTM in any way?
What I want to say is what I said earlier on. I mean, LSTM has a very unique model in terms of how you work. You are building critical mass for global health in different disciplines. At the same time, I think, you have very strong networks and relationship with the global south, which is very important. And also the approach is very unique in that I think there's the value for knowledge transition, from knowledge generation to transitioning it to tools that the governments or players can use. I think that approach is still relevant even now. It's important. And I want to also say that the issue of operational research, which is kind of like now we call it implementation science, but it's the same thing. Yeah. It is still varied now. It's still every time when you interact with players, there's always a question like, okay, how do we do this in a way that is acceptable, is feasible? So implementation science is still critical. Of course, we still have to develop new tools for vector control, which LSTM of Impact has been very, I should say they have played a very critical role. I mean, the LSTM affiliated consortiums in terms of, building new, for example, vector control tools for malaria response and other, diseases. It's important. But I think the implementation science, let's not lose that sight. Let's not lose our sight on it. It's still important, because for the tools that are developed, for them to be useful, to bring the results that we see, we have to understand how to implement and how to reach everyone, because that's the most important thing that I think sometimes it's not easy to acknowledge because it looks simple, but it's also very complex. How do we make sure that everybody is in from gender perspective and all other, areas that, affect access to health?
Well, thank you so much, Bertha, for those reflections. And we really appreciate you taking time out of your very busy schedule to join with us and to share your journey and the learning that's come from it. And for me, I've heard a lot about what leadership means in terms of focusing on partnership, listening, inclusivity, that strong focus on gender and equity. I've heard a lot around the focus on sustainability and how do we build partnerships that have sustainable impact. And I think the laboratory strengthening examples and the community partnership were very strong there. And I think you've given lots of fantastic advice to people at different stages in their career about seizing opportunities, building networks, being collaborative, taking the strengths from different disciplines and different methods to really unpack and understand situations. And we really appreciate your offer of support and networks and that people can reach out to you. So for me, it's been really wonderful to reconnect after too many years. And, I'm really proud that you're our alumna and proud of everything that you've achieved and look forward to staying in touch and hearing what comes next too. So many thanks, Bertha, for sharing, and we've learned a huge amount from you. Thank you.
Thank you very much, Sally, for your time. We hope we can. I hope I'm looking forward to coming to Liverpool just to come.
We'd love to invite you and we'll make that happen.
Yeah, thank you.
Thank you.